You took your pill this morning, you set it out the night before, maybe even checked it off a little mental list. And then you sat down, wrapped the cuff around your arm, pressed the button, and the number came back high. Again. That moment carries a particular kind of frustration. Not just disappointment, something closer to confusion, or even a quiet fear. Because you did everything right. So why isn't it working? Here's what's important to understand right away. If your blood pressure is staying high despite taking your medication faithfully, you are not alone, and you are not failing. What may be happening is that one or more factors in your daily life, things that seem completely unrelated, are quietly working against the medication. And once those are identified, there is often a real path forward. This is not about doubting your doctor or second-guessing your prescription. It's about understanding a picture that is almost always more complex than just one pill and one number. Just to be clear, nothing in this video is medical advice, and you should never stop, change, or add to your medication without speaking directly with your prescribing physician. What this video will do is give you a clear, practical framework to understand what might be happening and how to have a more productive conversation with your doctor. Let's start with something almost no one talks about: the timing of when you take your blood pressure medication. Most people assume that as long as they take the pill every day, the timing doesn't matter much. But for many common blood pressure medications, timing can make a meaningful difference. Blood pressure tends to follow a natural daily rhythm. It often dips during sleep and begins to rise in the early morning hours, sometimes quite significantly. This early morning surge is actually when many heart events are more likely to occur. Some medications are designed to be taken in the morning. Others may work better in the evening. The science on this has evolved, and research has suggested that for some people, taking at least one blood pressure medication at bedtime may improve overnight control. But, and this is important, this is not a general recommendation. For some medications and some patients, the timing matters differently. This is exactly the kind of conversation worth having with your doctor, because the answer depends on which medication you're taking and your specific blood pressure pattern. If you always take your pill at the same time and you're still seeing high readings, timing may be one useful piece to discuss. Now let's talk about something hiding in plain sight in most American kitchens: sodium. Most people know they should watch their salt intake. What many people don't realize is how much sodium can be present in foods that don't taste particularly salty. Processed soups, canned vegetables, deli meats, certain breads, sauces, and even some breakfast cereals can carry hundreds of milligrams of sodium per serving, sometimes more. And when sodium intake stays high, it makes it harder for blood pressure medications to do their job. Here is where the mistake often happens. Someone sees they've been avoiding the salt shaker, feels like they're eating healthier, and doesn't realize the sodium is coming from packaged or restaurant foods instead. The shaker is just one delivery system. The label is where the real number lives. The American Heart Association recommends aiming for no more than 2,300 milligrams of sodium per day for most adults, and for those managing blood pressure, even less may be beneficial. If you're not in the habit of reading nutrition labels, this might be the single most practical habit change to explore. 1 week of tracking sodium, even loosely, can be genuinely illuminating. This may seem like a small thing, but sodium is one of the most well-documented factors that can reduce the effectiveness of blood pressure medications. It's not a minor detail, it's often a missing piece. Now, here is something that surprises many people. And this is the kind of insight that tends to make viewers feel like they stayed for the right reason. Undiagnosed or undertreated sleep apnea is one of the more common but frequently overlooked causes of what doctors call resistant hypertension. blood pressure that stays elevated despite medication. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, causing the body to react with stress hormones and brief spikes in blood pressure throughout the night. When this happens for hours every night, it can keep overall blood pressure elevated throughout the day, even when medication is on board. The tricky part is that many people with sleep apnea don't know they have it. They may be told they snore, or they may wake up feeling tired without understanding why, but they haven't connected it to their blood pressure. If you have been told you snore loudly, if you wake up unrefreshed, or if you feel unusually tired during the day, this is worth mentioning to your doctor. A sleep evaluation can sometimes reveal a significant driver of high blood pressure that medication alone simply cannot address. This is one of those situations where the blood pressure isn't the root problem. It's the symptom of something else happening at night. Let's also address something that some viewers may be quietly wondering. Maybe this is just what happens with age. Maybe blood pressure is supposed to be harder to control as you get older. It's true that blood pressure management can become more complex with age. Blood vessels naturally become less flexible over time, and that can affect how the body responds to medication. But the answer to that complexity is not to accept high numbers as unavoidable. The answer is a more thorough evaluation, one that looks at the full picture, including lifestyle factors, medication type and dose, and possible secondary causes. Another common silent objection. Maybe I'm already doing enough. I take the pill. I've cut back on salt. I exercise sometimes. Maybe my body just doesn't respond well to medication. That may feel true, but medication response is also not fixed. There are different classes of blood pressure medications, different doses, and for many people, a combination of 2 or more medications works better than one alone. Some people require an adjusted regimen before finding what works. This is not unusual. It's actually a normal and well-documented part of blood pressure management. The key is identifying whether the issue is the medication itself, the dose, or the lifestyle factors working against it. There are also a handful of other, less common, but real contributors worth mentioning briefly. Certain over-the-counter pain relievers like NSAIDs, ibuprofen, and naproxen can raise blood pressure and interfere with some medications. Some decongestants found in cold medicines can do the same. Even certain supplements and herbal products can interact with blood pressure drugs. It is worth reviewing everything you take, prescription and non-prescription, with your pharmacist or physician, especially if your readings remain stubbornly high. Caffeine can cause a temporary spike as well. If you're checking your blood pressure shortly after coffee, that reading may not reflect your true baseline. So, what's the practical takeaway here? Start by doing a quiet audit of your own routine. When exactly do you take your medication, and is it consistent? Are you eating foods with hidden sodium, even occasionally? Have you been told about snoring or poor sleep? Are you taking any over-the-counter medications or supplements regularly? Do you check your blood pressure at consistent times after sitting quietly for 5 minutes without caffeine? These are not small questions. They are the exact questions your doctor will want to explore with you. And going into that appointment with even a rough sense of your patterns, your sodium habits, your sleep quality, your medication timing, makes that conversation far more productive. If your current medication doesn't seem to be working, the goal is not to give up on treatment. The goal is to find out why with the help of someone qualified to investigate it properly. Blood pressure that stays high despite medication deserves a closer look. Not panic, but attention. The heart and blood vessels are under real pressure when numbers stay elevated over time, and finding that missing piece genuinely matters. For most people, it exists. It's just a matter of identifying it. If this video gave you something useful to think about, consider sharing it with someone you care about who may be navigating the same frustration. And if you'd like more clear, practical health information like this, without the noise and without the confusion, we'd love for you to subscribe. Your comments are always welcome. We read them. Take good care of yourself and keep asking good questions.